Your period has completely stopped. It's been 2 months, 3 months. You're not pregnant. You're not going through menopause. You're just no period. That's scary. But here's what you need to know. A completely missing period, amenorrhea, has specific causes and most are treatable. Today, we're breaking down why your period might have stopped, when you should be concerned, and what you actually need to do about it. First, let's get clear on when this actually warrants concern. If you've missed your period for 3 months or longer, and you're not pregnant and not approaching menopause, that's when you should see a doctor. Not in a panic, but definitely make an appointment. If your period stopped suddenly when it was previously regular, that's significant. Your body changed its pattern, which indicates something shifted. However, if your period has always been irregular, sometimes skipping months, that's more common. It's still worth investigating if it becomes more irregular or stops entirely for long periods, but it's less urgent than a sudden change. If you have other symptoms, severe weight loss, excessive exercise, extreme stress, medication changes, amenorrhea might be expected and could resolve once the underlying issue is addressed. The key question, is this new for you, or is this your normal pattern? Why does amenorrhea happen? Let's go through the most common causes. Pregnancy is the most obvious. If there's any possibility you're pregnant, take a test. Urine tests are accurate from the first day of a missed period. Blood tests can detect pregnancy earlier. Hormonal birth control can stop your period. Some forms, like hormonal IUDs or the implant, intentionally suppress periods. If you started birth control and your period stopped, this is expected and normal. It's safe. Extreme weight loss or being underweight triggers amenorrhea. Your body interprets this as a resource-scarce situation and shuts down reproduction. This commonly happens with eating disorders, excessive calorie restriction, or extreme dieting. If this applies to you, professional help, nutritionist, therapist, doctor, is important. Excessive exercise, especially combined with undereating, causes amenorrhea. Athletes and people doing intense training without adequate nutrition frequently experience this. It's sometimes called athletic amenorrhea. The body prioritizes survival over reproduction. Stress, chronic, severe stress, can halt your period. High cortisol interferes with reproductive hormones. This can happen with major life stress, grief, trauma, or chronic anxiety. Once stress is managed, periods typically return. Thyroid dysfunction, both overactive and underactive, disrupts your cycle. Thyroid hormone affects reproductive hormones. If you haven't had thyroid testing, that's worth pursuing. PCOS can cause long periods without menstruation. Irregular ovulation means irregular or absent periods. Premature ovarian insufficiency, your ovaries failing prematurely, stops periods before age 40. This is less common but serious and needs medical evaluation. Pituitary disorders or problems with hormonal signaling can halt periods. Your pituitary gland controls reproductive hormone production. Polycystic ovary syndrome causes amenorrhea in some women. Certain medications, antipsychotics, some antidepressants, cancer medications can stop periods. So physiologically, what's happening when your period stops? Your menstrual cycle is controlled by a delicate feedback loop of hormones. Your brain produces GAN-RH. Your pituitary responds with FSH and LH. These signal your ovaries to produce estrogen and progesterone. This hormonal symphony results in ovulation and menstruation. When any part of this system gets disrupted, stress affecting brain signals, thyroid dysfunction affecting metabolism, extreme weight loss making reproduction seem non-viable, the cycle stops. Amenorrhea is your body's way of saying something is wrong with the system. It's a symptom, not a disease, but it's your body's signal that attention is needed. The problem is, prolonged amenorrhea, months without periods, can have consequences. Your body needs some estrogen for bone health, cardiovascular health, and other functions. Prolonged amenorrhea without treatment can lead to bone loss, which increases fracture risk. This is particularly concerning if you're young and should be building bone density. This is why, even if amenorrhea doesn't feel immediately dangerous, prolonged untreated amenorrhea matters. Here's your action plan. See a doctor if your period has been absent for 3 months and you're not pregnant and not menopausal. This is the standard threshold where investigation is warranted. See a doctor sooner if you have severe symptoms alongside amenorrhea, extreme weight loss, severe pain, major life stressors, or other health changes. What will your doctor do? Take a detailed history, do a physical exam, Possibly run blood tests to check hormones, FSH, LH, estrogen, progesterone, thyroid, prolactin. They might do an ultrasound to examine your ovaries and uterus. Based on findings, they'll determine the cause and recommend treatment. Be honest with your doctor about diet, exercise, stress, medications, and any weight changes. These details help identify the cause. If your doctor dismisses your concerns, seek a second opinion. A gynecologist or endocrinologist experienced with amenorrhea can provide better assessment. If you're experiencing amenorrhea, here's what you can do. First, rule out pregnancy. Take a test if there's any possibility. Address the obvious. If you're under-eating, start eating more. If you're over-exercising, reduce intensity. If you're under extreme stress, address stress management. If you recently started medication, ask your doctor if it could be the cause. See a doctor to investigate. Most causes of amenorrhea are treatable once identified. If it's stress-related, therapy, meditation, yoga, or lifestyle changes help. You don't need medication, you need to reduce stress. If it's weight-related, gradual healthy weight gain usually restores periods. Work with a nutritionist. If it's exercise-related, reducing intensity and eating adequately helps. You don't have to stop exercising entirely, you just need balance. If it's hormonal, thyroid, PCOS, pituitary, medical treatment addresses the underlying condition. If it's birth control, understand that for many hormonal methods, this is intentional and safe. Don't ignore it. Don't assume it will resolve on its own. Get evaluated, identify the cause, and address it. Amenorrhea is treatable, and your periods will likely return once the underlying issue is resolved. Your period stopping completely is your body's signal that something needs attention. It might be stress, weight changes, overexercise, medication, or a medical condition. Whatever the cause, it's worth investigating. See a doctor, identify the cause, and address it. In most cases, periods return once the underlying issue is resolved. You deserve answers and proper care.